Hello, welcome to the Illumia MD Online Training Academy. My name is Victoria. I'm a clinical educator for Illumia MD, and in this micro-teach we'll be looking how we can treat and address the skin condition pigmentation. Before we can truly understand how to address and treat specific skin conditions, we must first have a solid understanding of the anatomy and physiology of healthy youthful skin. Knowing how the skin functions when it's normal and youthful and healthy will help us understand how some of these processes can misfire, leading to pathways that result in skin conditions such as acne, rosacea, pigmentation and aging. The skin is the body's largest organ. It's designed to help us keep our organs protected from the external environment. It's also designed to help our nutrition and energy inside the body. Its role also includes heat regulation, sensory indications, and it's designed to absorb some nutrients from serums, moisturizers, and medicinal creams. The skin is broken down into three separate layers. The epidermis, our outermost layer, which is made up of 95% skin cells. The dermis, which is made up of up to 90% collagen and elastin. And the hypodermis, where our fat cells, blood vessels, and nerve endings reside. Let's first explore the epidermis in depth. The epidermis is made up of 5 major layers, ranging from the stratum basalis up to the stratum corneum. The stratum spinulosum is only found on the palms of the hands and the soles of the feet, so the facial skin has 4 major layers. The basal layer is the point where new skin cells are made. In this layer we have epidermal stem cells, and the stem cells' job is to duplicate themselves, creating daughter cells. These daughter cells will then differentiate into keratinocytes or skin cells. These skin cells will make up the first layer of our epidermis. You can think of these cells a little bit like grapes. They're very juicy, there's lots of intercellular fluid, they have a very solid phospholipid bilayer cell wall which you could peel a little bit like the skin of a grape. These cells also have lots of DNA information and should have healthy levels of pigmentation. As the body makes a new skin cell layer, it pushes this previous skin cell layer onwards and upwards through the layers. This is called keratinocyte maturation. As these skin cells progress through these 4 layers, they will compact, they will start to lose some of their intercellular fluid, and they will begin to keratinize or harden. As they eventually become a dead skin on the surface of our facial skin, they are so compact that they almost look like a crisp or chip. You can think of these skin cells a little bit like bricks that make up a brick wall, and keeping these bricks nice and compact is the extracellular fluid. This, like the cement, keeps our skin cells nice and compacted and connected via desmosomes. You could think of desmosomes a little bit like a Velcro hook that keeps the skin cells connected. These desmosomes are very strong in the lower layers of the epidermis, where there's up to 85% hydration. As the skin dehydrates towards the surface, where there's as little as 15% hydration in the horny layer of the skin, the stratum corneum, these desmosome bonds can become weak and eventually snap. That's what allows these dead skin cells to shed off of the surface of the skin. This is natural exfoliation known as desquamation. Desquamation happens all day as we touch our skin, as the wind brushes our face, and as we cleanse. This is called cellular turnover, or a keratinocyte maturation cycle. In a young, healthy skin, this cellular turnover will take roughly 28 days, meaning that it takes only 4 weeks for the body to make a brand new differentiated keratinocyte, for it to mature through the levels, becoming a corneocyte on the surface of the skin that sheds off. This means that a youthful skin is excellent at replenishing and replacing damaged tissue. This damage could be a scrape to the skin, an acne lesion. It could also be sun damage or sunburn. Underneath the epidermis, we have the dermis, and this is where our collagen and elastin is made. There are 2 different types of collagen relevant when talking about youthful skin. Collagen 1 is responsible for keeping our skin compact, and collagen 3 is responsible for wound healing that occurs if we experience an acne lesion or slight burn on the skin. This is responsible for keeping our skin tight and taut. Both collagen 1, collagen 3 and elastin are made by fibroblast cells in the dermis. Some skin specialists would argue that the fibroblast cell is the most important cell in our skin because it makes up to 6 constituents, including hyaluronic acid, our body's natural hydration. Hyaluronic acid is a glycosaminoglycan cellular matrix that sits in the dermis that keeps our skin plump and healthy. The hydration made by our gag cells also contributes to our acid mantle that keeps the body protected from external environments and free radicals. Another component to this hydrolipidic barrier is sebum that comes from our sebaceous gland that resides in our hair follicle. The hair follicle is also sometimes referred to as a pore. So when people say I have blocked pores or open pores, they are talking about the hair follicle itself. The sebaceous gland resides in the hair follicle and is responsible for making sebum. Sebum is made up of ceramides, fatty acids, and squalene in the skin. When this sebum is made in healthy levels, and so is hydration made by our glycosaminoglycans in the dermis, they mix to make a hydrolipidic barrier that sits on the superficial layers of the skin. This does 2 major jobs. First of all, it keeps intercellular fluids inside the skin. This prevents transepidermal water loss. So if hydration tries to escape the skin, it keeps the hydration in, meaning that we maintain our healthy skin hydration levels. It's also designed to keep bacteria and free radicals out of the skin. As they try and penetrate our pores, they will be repelled by the acid mantle. Now, when the acid mantle or hydrolipidic barrier is in balance with equal amounts of sebum and hydration, we have a normal skin type. However, when we have more than one or not enough of the other, we can start to indicate as a specific skin type. For example, if you have too much oil, you would indicate as an oily skin type. If you have not enough oil, you would indicate as a dry skin type. If you have not enough hydration, you would present as a dehydrated skin type. Some people have not enough hydration and not enough oil. This would mean that the hydrolipidic barrier has been compromised, and that can lead to sensitivity. Some people will have a combination of both too much oil and not enough hydration, leading to a combination skin type. Now, some of these skin types will be closely associated to skin conditions. For example, oily skin is very closely connected to acne. Sensitive skin is very closely associated to rosacea, but there's not necessarily always a direct link. One skin condition that is not determined by skin type is pigmentation. Pigmentation in our skin is vital for photodefense. This means that the pigmentation that resides in our skin cells protects the DNA inside our keratinocytes from DNA damage from the sun rays, both UVA and UVB. So it's an essential part of our skin's defense. We have a Fitzpatrick system in the aesthetics industry that helps us indicate and identify a client's natural pigment level in the skin. A Fitzpatrick 1 would typically be a fair skin and red head patient who's very sensitive to sunburn, right the way through to a Fitzpatrick 6 who would have a very high pigment, often black hair, and be very unsensitized to sunburn. Depending on somebody's natural pigment level, you could see sensitivity towards hyperpigmentation. The pigmentation in our skin is made by melanocyte cells that sit in the basal layer of the epidermis. You can see here the structure of the melanocyte is a little bit like a hand. The palm of the hand is the factory of the melanocyte where pigment is made, and they're produced into what's called a melanosome. Melana meaning menelin, zome meaning packet, a packet of pigment. This melanosome will then travel up through dendritic fingers of the melanocyte cell and will feed pigmentation into roughly 30 skin cells in its near vicinity. When the melanocyte cells are making healthy levels of pigmentation and dispersing the pigmentation horizontally throughout the skin, we have an even skin tone. When a cluster of melanocyte cells make too much pigmentation or start to disperse the pigmentation vertically, we can see patches of pigmentation on the skin, leading to an unclear and mottled skin condition. When all of our cells, including our keratinocyte stem cells, our melanocyte cells, our fibroblast cells and our glycosaminoglycan cells are all functioning well, we will have a normal skin type that looks normal and healthy. It's only when some of these cells misfire or misbehave that we present with a skin type. Now that we understand how the skin works when it's functioning healthily, we can explore individual skin conditions and how we can treat and address their symptoms. Now that we understand how the skin functions when it's healthy and youthful, we can explore the physiology of hyperpigmentation. Hyperpigmentation is categorized by darker areas of the skin. Some small areas like freckles, some more large areas as with a hormonal-related melasma or chloasma. Whether pigmentation is caused by hormone disruption, trauma to the skin, or exposure to UV radiation, the physiology of pigmentation is the same. It's hyperproduction of melanin from the melanocyte cells that sit in the basal layer of our skin, and that's what needs to be targeted. Melasma, sometimes known as chloasma, is hyperpigmentation caused by a hormonal imbalance. This can sometimes be a natural cycle. This could be because of the contraceptive pill. This could be because of IVF. It could also be because of pregnancy. Melasma is characterized by perfectly symmetrical pigmentation on the face. Melasma is often made worse or permanent by further exposure to ultraviolet radiation. When trying to assess whether your client's pigmentation is hormonal related, have a look at the symmetry of the pigmentation on the skin. It may appear worse or more mottled on one side. Before you try to address this type of pigmentation, suggest to your client that she explores the idea of endocrine disruption. It might be that she wishes to change her contraceptive pill, wait for the completion of her pregnancy, or address endocrine disruption with her medical professional. Post-inflammatory hyperpigmentation is common in Fitzpatrick's 4, 5 and 6, whose skin are very accustomed to making pigmentation anyway. Post-inflammatory hyperpigmentation will be the direct result of inflammation in the skin. This inflammation could be caused by an acne lesion, a burn to the skin, or an ill-performed aesthetic treatment. Often patients will come into the clinic and say that they have up to 10 acne lesions. Actually, only 2 of them are still active. The other 8 are darkened patches left behind after the acne lesion has been repaired. Post-inflammatory hyperpigmentation is also hyperproduction of melanin by the melanocytes and trauma to the area of skin. When trying to target or address post-inflammatory hyperpigmentation, it's vital that you also address the skin concern that's causing the post-inflammatory hyperpigmentation. We want to reduce inflammation in the skin and control acne lesions so that we can prevent further post-inflammatory hyperpigmentation. Post-inflammatory hyperpigmentation can occur in a Fitzpatrick 5 or 6 if they undergo a medical, clinical, chemical peel without pre-treating the skin first. It's vital that we use melanin-suppressing peptides and products for 2 weeks before a chemical peel to suppress these melanocyte cells so that they don't respond to a chemical peel with post-inflammatory hyperpigmentation. If this does occur, it can be corrected by targeting hyperpigmentation in general. Whilst you will see patients with melasma, chloasma and post-inflammatory hyperpigmentation, you will probably see hyperpigmentation associated with aging. This is also known as photo damage or sun damage. Photo damage is hyperpigmentation caused as a direct result to ultraviolet radiation, and there's a very specific pathway that ensues when we tan. Exposure to ultraviolet radiation stimulates inflammation in the upper layers of the epidermis. This in turn triggers the alpha melanocyte stimulating hormone. This in turn triggers melanocortin-1 receptor on the melanocyte cell and triggers the production of melanin from the melanocyte. This hyperproduction of melanin through melanosomes that travel through the dendritic fingers of the melanocyte will inject into the skin cells and act like a sun parasol for the DNA nucleus of our skin cells. This is why we tan when we go on holiday. There's no such thing as a healthy tan. Sometimes the DNA damage caused to these melanocyte cells can make this process permanent, meaning even when we return from holiday, some melanocytes are still pumping out as much pigmentation, and this can look like a mottled skin complexion or patches of sun damage. An individual sunspot known as a solar lentigo can look like a large freckle on the skin. Lentigos in collection are known as solar lentigenes. This is what leads to that mottled, aging skin complexion. Whether you are experiencing hyperpigmentation because of melasma, post-inflammatory hyperpigmentation, or solar and photo damage, the melanocyte pathway is the same. This pathway is known as melanogenesis. Tyrosine is an amino acid that resides in the factory of the melanocyte cell. Stimulated by the enzyme tyrosinase, converts into DOPA, dihydroxyphenylalanine. Dihydroxyphenylalanine is then converted into dopa-quinone. There are a few more steps on the melanogenesis pathway that eventually ends in the production of melanin. There are two types of melanin prevalent in the skin. eumelanin, which gives a blue-black tone, prevalent in Fitzpatrick's 5 and 6, and pheomelanin, which gives a reddy-orange colour, common in Caucasian skins. Eumelanin is the pigment that's produced in response to trauma. Pheomelanin is more common in freckles, and as skin and medical professionals, we wouldn't necessarily consider a freckle a solar lentigo. We do, however, want to target hyperpigmentation caused by both pheomelanin and eumelanin in patients with melasma, photo damage, and post-inflammatory hyperpigmentation. And we do this by suppressing the melanogenesis pathway. By controlling the enzyme tyrosinase, we can target how much tyrosine is converted into DOPA and dopa-quinone, reducing the amount of pigmentation that's made by the melanocyte cells. So whether you are trying to target pigmentation that's hormonal related, photo damage related, or trauma related, it's the same melanogenesis pathway that needs to be interrupted. When targeting hyperpigmentation, it's vital that your client engages in both clinical chemical peels and correct adjunctive skincare. There's not a single skin condition that wouldn't benefit from a series of chemical peeling treatments. There's a common misconception that chemical peeling will thin the skin or make the skin more vulnerable, but actually it's the complete opposite. Chemical peels work by lowering the pH of the skin, encouraging dead skin cells to exfoliate. When so much surface skin is removed from the epidermis, the body responds by replenishing that missing skin with healthy new skin tissue. Stem cells are stimulated, they begin to proliferate new skin cells in the basal layer, and actually this is healthy new tissue with a very nice thick plump cellular density. So actually we increase the thickness of the basal layer, we increase the density and intracellular fluid of the lower epidermal skin cells, and we also thicken and strengthen the dermis by stimulating collagen synthesis. We compact the epidermis, making it strong and sturdy, helping to protect against the environment. This replacement of healthy new tissue helps to regenerate the skin and replace any skin lesions such as acne, blackheads, whiteheads, pigmentation. It improves the appearance of lines and wrinkles and will help with the overall complexion of the skin. The specialized chemical peels that you would select to address an aging skin type or skin concern would be a 30% lactic acid peel. 30% lactic acid will work in the superficial epidermis to break down the keratin bonds that keep dead skin cells attached. This will trigger cellular regeneration, beginning to lower the epidermis, compact the horny layer, and stimulate cellular turnover. A 30% lactic acid AHA peel is ideal for early onset aging or those new to chemical peeling. Should you want to enhance cellular regeneration further and stimulate more epidermal rejuvenation by offering a deeper epidermal peel, you could utilize the Illumia MD Glow Peel. This is a modified half-Jesner self-neutralizing peel that contains 7% lactic acid, 7% salicylic acid and 7% resorcinol. The lactic acid is hydrophilic, hydro meaning water and philic meaning loving. This means it will play around with the water in the superficial epidermis. Salicylic acid is lipophilic, lipo meaning oil and philic meaning loving. This means it will get into the hair follicle and help to trigger epidermal rejuvenation and reepithelialization from the hair follicle. Resorcinol is lipophilic, meaning it will work in the hair follicle. It's also hydrophobic, which means it will be driven away from the hydration in the surface epidermis down into the lower layers. The glow peel is pass dependent, meaning the more passes of the glow peel you apply, the deeper regeneration you will stimulate. One pass would be ideal for clients who are suffering with aging and rosacea or sensitive skin type. A patient with a thicker photo-damaged or more advanced aging will benefit from up to 4 layers of the glow peel. You can also enhance your chemical peeling treatment with the vitamin A boost, which is a combination of 3% vitamin A, 1% retinol and 2% retinol palmitate. There's also 22% lactic acid. The combination of vitamin A and lactic acid in a boosting serum will dramatically improve your cellular turnover and can increase your patient's social downtime, meaning that they may physically see peeling and shedding in the days following their chemical peel. Be sure to make a thorough consultation with your client, understand your client's expectations and what they'd like to see from a chemical peeling treatment. When building a hyper-customized home care program for your patients that are experiencing hyperpigmentation, it's vital to consider epidermal rejuvenation and interruption of the melanogenic pathway. We must include lots of exfoliation throughout the week at home to maintain and gain on the benefits that your patients will see from chemical peeling. Every skincare routine should start with a cleanser of your client's choice. If she or he would prefer a wash cleanser, she could use the purifying gel cleanser. If they would prefer a more hydrating cleanser, they could use either the Hydra Boost or Sensicalm. Commonsensically, if your patient's hyperpigmentation is caused by post-inflammatory hyperpigmentation associated with acne, they may enjoy the Acne Clarifying Cleanser with 2% encapsulated salicylic acid. We must use the Bright and Clear solution, which utilizes 3% lactic acid to consistently dispose of cellular debris on the surface of the epidermis, helping to maintain healthy cellular turnover and epidermal rejuvenation. It's important that your client maintains thorough exfoliation throughout the week. She can do this with the AHA Renewal Serum, which utilizes 8% lactic acid, and the Enzymatic Peel, which is a leave-on exfoliating mask treatment, utilizing 10% lactic acid, as well as pineapple and papaya, which will help to lighten and brighten the skin complexion. We must support this epidermal rejuvenation surface exfoliation with stimulation of the stem cells by utilizing vitamin A. The retinol resurfacing serum comes in 3 different strengths: 0.25, 0.5 and 1%. Somebody who indicates with a superficial mild hyperpigmentation would benefit from the 0.25%. A patient who indicates with a thicker skin type and advanced photoaging would benefit from the 1% dose. Using AHA for superficial exfoliation and supporting with vitamin A for stimulation of the stem cells will dramatically increase cellular turnover and rapidly improve the appearance of hyperpigmented cells. We must support that exfoliation with melanogenesis control. We must target the melanocytes specifically and interrupt the menanin production pathway. We can do this in a number of ways. Using a tyranase suppressing peptide, B-white, in the even-toned brightening serum will interrupt the conversion of tyrosine into dopa and dopaquinone. The even-toned brightening serum also contains niacinamide vitamin B3. This will help prevent the melanocyte keratinocyte transfer of melanosomes. The Even Tone Brightening Serum is hydrating and gentle, making this ideal for dehydrated or dry skin. The IntelliBright Complex utilizes kojic acid. This comes from the mushroom family and will help to degrade existing pigmentation within the keratinocytes. It also has arbutin, which converts into hydroquinone in the melanocyte cell for rapid lightening of hyperpigmentation. The lightening lotion utilizes 2% medical grade hydroquinone. This will have an advanced lightening effect on the hyperpigmentation. You should use hydroquinone for a maximum of 12 consecutive weeks and then take a break for 6 months. You can use your lightening lotion in combination with the Even Tone Brightening Serum and use the IntelliBright Complex when you're not using your lightening lotion. The Vitamin Rich Smoother utilizes 15% medical grade ascorbic acid, which is bioavailable vitamin C. Vitamin C has natural anti-melanogenic properties, so will help to support the suppression of pigmentation. It's also incredible at lightening and brightening the complexion, leading to a more flawless finish in the skin. No matter what skin condition you're trying to address, it's vital that we protect our epidermis and our dermis from harmful rays that come from the sun. When thinking about sun protection, there are 2 major rays that we need to consider: ultraviolet alpha and ultraviolet beta, more commonly known as UVA and UVB. UVB ray is the one that we all know about. It creates sunshine, it's nice and warm, it causes shadows. It's a nice summer's hot day. We all know about wearing sunscreen when UVB rays are out to play. In fact, we pay a fortune to go and sit in UVB rays on holiday. UVB is a short light wave that penetrates just past the stratum corneum in the epidermis. The body converts this light into heat. We know this. This is the premise of every light-based therapy in the aesthetics market. That heat can then build in the skin and essentially cook our skin, leading to sunburn. However, not many people are aware of the damaging effect of UVA radiation. Ultraviolet alpha is a long light wave that can penetrate past the epidermis via the hair follicle into the dermis, and it causes DNA damage to every cell that it makes contact with on the way down. Ultraviolet radiation accounts for 90% of our aging and can considerably make skin conditions such as pigmentation and aging worse by causing DNA damage to melanocyte cells and fibroblast cells. Ultraviolet alpha, or UVA, is in equal measure every second of daylight. So it doesn't matter whether it's a sunny summer's afternoon or a blustery winter's morning, you are experiencing the same exposure to UVA year-round every second of daylight. So it's imperative that we wear a broad spectrum SPF every single day, even if we work indoors, because ultraviolet alpha can travel through glass. So what does broad spectrum mean? Broad spectrum means that it protects you against UVB and UVA rays. So it will protect you from sunburn and from sun aging. There's only one ingredient used in luxury medical products that will offer broad spectrum protection all day, and that's the mineral zinc oxide. Zinc oxide is a physical sunscreen filter, which means that it sits on the surface of the epidermis and creates a mirror-like effect that bounces the sun rays off of the skin. The molecular structure of zinc oxide is a little bit like a snowflake that's made out of mirror. It's that mirror-like surface that allows the reflection of the sun rays, avoiding penetration of them into the skin. But the mesh-type effect of that structure means that zinc oxide is a breathable ingredient, meaning that it won't clog your pores, it won't make your skin greasy, and it won't give you that tacky feeling sometimes associated with sunscreen. It's vital that we all wear a broad spectrum sunscreen every single day to help target and address multifaceted skin conditions. It's the most important thing you can do to maintain a healthy, youthful complexion. The great thing about the Illumia MD physical mineral broad spectrum sunscreens is that whilst addressing the hyperpigmentation, you can also conceal it. If your client would like a full coverage foundation that matches her skin tone, why not give her the Moisture Matte Broad Spectrum SPF 40? This will offer a blended skin tone to help with evening the skin complexion. If your client would like a lighter coverage, the Sheer Hydration Versatile Tint offers a tinted moisturiser finish that's versatile to all skin types and tones. Be cognizant of the cause of your client's hyperpigmentation. If it is pigmentation caused by acne, be sure to prescribe the Clear Shield Broad Spectrum Sunscreen SPF 42, which is oil-free and non-comedogenic. I hope you find this helpful. If you would like any other information or support in targeting and addressing hyperpigmentation, please contact your regional business development manager or regional trainer who will be happy to support you more in this area. Thank you for watching.